I'm Dr. Dave Janda. Welcome back to our ongoing Operation Freedom Health and Wellness series with Dr. Peter Glidden, one of the top naturopathic physicians in our country, if not the world, in addition to being a fantastic author. His two books, well, if they had book burnings in medicine, his probably would be two of the first on the bonfire. One already you can't even get. Please thank Jeff Bezos and Amazon for that. His two books, Everybody's Sick and I Know Why, and Attempt to Cure with Holistic Medicine, are must-reads if you can get your hands on them. What Peter and I have tried to do over the past 6 years is educate and empower you with information you're not going to get through the bought-off lamestream fake media or through the medical industrial complex. Now, by training, I am an MD, an allopathic physician. By training, Dr. Glidden is a naturopathic doctor, an ND. According to the powers that be, Peter and I are supposed to despise each other. We're not supposed to work together. We're not supposed to empower you. That's what we've done with this series, and we've taken it an extra step. We've developed a couple websites, operationfreedomhealth.com, that has a wealth of information. In fact, Dr. Glidden has provided a free video there as well, the 12 bad foods to prevent inflammation. That your MD, allopathic physician like myself, 9.9 out of 10 of them don't know anything about. Dr. Glidden has a website, leavebigpharmabehind.com, with a huge amount of information in addition. Now, the products, full disclosure, the products we discussed today are available on operationfreedomhealth.com, and purchase of the products on operationfreedomhealth.com does support this platform and for us to continue providing this information that you're not going to get from other sources. What we're going to do today, I'm not sure has ever been done before. In fact, I know it hasn't. What we're going to do is we're going to talk about the two different approaches to a specific type of disease, arthritis, but you can apply it to any disease. How a naturopathic physician like Dr. Glidden would approach the issue of arthritis, and how allopathic physicians approach arthritis. Now, I have a history that I've mentioned to you before of having significant arthritis in my neck and my back and the like. And as I've mentioned before, I was on multiple prescription-grade anti-inflammatories in addition to over-the-counter anti-inflammatories such as ibuprofen, and also taking Tylenol to try to help with my symptoms. And it got to the point where my colleagues, other allopathic physicians, said, Dave, the only way we're going to get this back and neck turned around is we got to do a surgery. And because since you failed the big pharmaceutical products, and, one of the big things in allopathic medicine is you come into the doc and go, it hurts when I do this. Well, don't do this. Right. Okay. Well, there's something to that, but sometimes you got to do this if you're a photographer maybe or something to live. So it doesn't play in. And when big pharmaceutical products don't work, what usually tends to be the next step is surgery. And that's what they wanted to do with me. And meanwhile, Dr. Glidden was saying to me, why don't you try a nutritional approach to your problem? And I was actually very skeptical. And the reason why I was skeptical is because my allopathic training it didn't never. We had 2 minutes of training as it relates to nutrition. I can tell you what it was. If you eat polar bear liver, you could well die of hypervitaminosis A. No, that was it. That was biochemistry, my first year of medical school, and that was it. And I really was quite uneducated, as all allopathic physicians are, on nutritional side of the equation. So I went on this program, the 90 essential nutrients that Peter and I talk about, the foundation pack. And within a month, I was off of all prescription-grade anti-inflammatories, no longer taking ibuprofen, no longer taking Tylenol, doing things outside chore-wise for hours that if I would have even tried to do that before, it would have been, I better take some extra doses of you name it, of the ibuprofen, of the Tylenol, of the, maybe I'm only supposed to take the prescription grade anti-inflammatory twice a day. Maybe I'll take it 3 times a day. And that's been the case for years since I went on the nutritional program. I wouldn't have known to do that if it wasn't for Pete. And when I went to see my friends that were allopathic physicians that were talking about doing surgery on my neck and spine, they did a physical exam and they said, something's wrong. What's wrong? Your exam is like normal. You don't have the weakness, you don't have the numbness, you don't have the what's going on? And I said, well, I went on a nutritional program. And they all looked at me and said, and they'd laugh, and they go, no, seriously, what? They weren't being mean.
Yeah.
Right? And this is what we want to talk about today. Yeah. So let's talk about the differential in approach, Pete, because it really comes down to the foundation. And unfortunately, the foundation from the allopathic side of the equation, if I really look at this hard, is that in every medical school, allopathic medical school in the country, MD medical school, if you want to look at it that way, they have the chair of biochemistry, which is funded by Pfizer. We have the chair of pathology, funded by Merck. We have the medical school funded by Upjohn.
Right.
Yeah. And really, Pete, I don't know, maybe this is too simplistic. You've done a lot of work on this, but my experience is actually that's a big part of the problem. In fact, if not the entire problem, because the funding drives what people are taught, which drives the fact that the nutritional side of this equation, which you're an expert at, is never discussed.
Well, and also the nature of the education itself, with the long hours and the stress and the long hours and the stress and the long hours and the stress and then some more long hours and then some more long hours and then some more stress. It was with residencies, right? That was designed on purpose. Mm-hmm. That model, that academic model was designed on purpose in order to make the people going through that process think in this direction only. Mm-hmm. Right? Mm-hmm. And that, sadly, you are the exception that proves the rule, but it is most MDs, when they graduate and do their residencies and now they're practicing, they actually are of the belief that if I wasn't taught it in medical school, it's simply not valid. I mean, it's not like, oh, yeah, there's room in the world for everybody and let's investigate this. No, that alternative stuff is quack medicine. They didn't teach me that at Harvard, so it can't be valid. I'm not even going to bother to go there. That's the problem, that in addition to, the monopolization of the education and the philosophy that informs the education, there's also that, which is a really, really big deal, and it's why it's very difficult for medical doctors. I mean, even when they're confronted with information right in front of their face, like they have a patient like you, a friend, a colleague like you who needed surgery, bad arthritis, so, let's go, boys, and then 6 weeks later, they're fine.
Yeah.
They can't wrap their heads around the fact that something other than the pharmaceutical or the surgical approach could do that because of all of this nonsense. And so it's a big, big problem. So you really need to give yourself a big pat on the back, Dave, because you've broken through that matrix, and there aren't that many people that can have the intellectual courage to be able to do that.
Well, and one of the other issues, Pete, you mentioned this, about if I wasn't taught this in medical school, it must not be right.
Yeah, right.
Well, here's the thing. Many people think medical school only lasts 4 years, which is long enough, but only 4 years. It actually lasts as long as you have to pay your student loan debt, because you keep seeing that statement every month. So all these MDs, they paid somewhere 60 to 100 grand a year.
Yeah.
Went in debt. So you come out of debt out of medical school, $400,000, $300,000 in debt. You're seeing these huge bills every month that you have to pay for your for what you went through. And so to come to the conclusion, and it's another way to negatively reinforce the fact
Right.
of not looking at other means.
And then, for the icing on the cake of irony, in the 21st century, it is the rare doctor, MD, who's in private practice.
Right.
Most medical doctors work for groups. They work for hospitals that work for groups. And so they can't do whatever they want to do, even if they do see the light. Oh, you can't do that because that's not the standard of care that my employer says I must toe the line to.
And what pushed that was Obamacare. A lot of people don't want to admit this. I said this at the time. Yep. Obamacare ended private practice and group practice. Yep. And it pushed people to be owned by conglomerates, and these conglomerates that are run by bean counters that have no functional medical knowledge and only kneel at the altar of the almighty dollar, and that would mean big pharma. They tell the docs who work in these conglomerates, you do this or you're done. And and you might say
the story of your colleague who worked at the place that you retired from, and now they're followed around by administrators who only let them spend 6 minutes with each patient.
Right.
You got to be kidding me.
It's unheard of. At least when I was, when we were going through the gauntlet of being able to practice medicine. Yeah. But that's medicine today. Yep. And people need to be aware of that.
Yeah. So it's one big system, self-policing, self-regulating system, which punishes its members for thinking outside of the box.
Very true.
100%. Mm-hmm. I mean, that's the best way to put it in short. And look, man, every time I'm in the dentist chair, I thank God for lidocaine. Mm-hmm. I mean, sometimes you need the surgery.
Right. Right.
You get a bullet in your leg in Iraq, you need the surgery. Mm-hmm. You step on a landmine, get your leg blown off, you need the surgery. You're in an automobile accident, you have a bleeding femoral artery, you need surgery. I mean, this isn't a diatribe against allopathic medicine, it's a diatribe against a monopolized medical market that only offers one type of medicine, one type of medicine, one type of medicine. And even when it fails, right, nothing happens. Vioxx kills tens of thousands of people. Right. Nobody goes to jail. No. Bextra, nobody goes to jail. No. So it's a big problem. All right. So let's break this down pragmatically for the listening audience. Okay. So let's say you've got a 45-year-old male. He shows up in your office, and he has been diagnosed with osteoarthritis of his shoulder. Mm-hmm. Okay. So what are you going to do? What do you do to diagnose and to, what's the kind of recommended triage there?
So in our office, and what I would do, first, history. Look for, was there any trauma? Then a physical exam. Yeah. Preliminary test would be an x-ray. Yeah. Okay. So let's say the x-ray comes back, no trauma. Okay. Yep. Physical exam consistent with arthritis of the shoulder. Yep. X-rays consistent with arthritis in the shoulder. Yep. Now, in my algorithm of treating somebody with that, yep, we would talk about what gives them trouble, activities of daily living, and work-wise, and how to modify those activities so they could keep doing them but not have as much pain or discomfort doing them. Right. Number two, we would have a discussion about icing. I used to drive people nuts about this, but about how ice makes, and they will look at you, people who have arthritis, and say, well, heat makes me feel better. Yes, initially it does, but what happens 2 hours after you heat? Well, I stiffen up like a board and it just hurts more. Right. Because the heat increases blood flow, but what it ends up doing is it brings more blood flow, but you get more inflammation, more swelling. So if you do heat, you always ice after. Okay? Mm-hmm. The third thing I would do is I would say, now we need to talk about anti-inflammatories. Mm-hmm. Now, there are different types, I would tell folks. You can do prescription grade. You can do over-the-counter, and I would say there are natural products such as turmeric that could be utilized, and other products that could be used to reduce some of the inflammation that you're experiencing.
Right.
In addition to that, there are physical therapy programs that can be done. And if you will, ultrasound treatments to reduce the inflammation, and strengthening programs through physical therapy to help you with your condition. So that would be the initial visit.
Okay, very good. Inside of that thought process, does anyone ever ask the question or ponder the notion of what created the inflammation in the first place?
So usually, yes.
Outside of trauma.
Right. So that's where the history comes in. Okay. So I notice this because I am a carpenter, and every time I'm working overhead, this is where I get into issues. Okay. And this is where I start having the problem. So a lot of that would come out in the history. But understand but understand something though, Pete. I ran a secondary and tertiary referral practice for orthopedic. So people would already have been seen by their primaries and sometimes by at least one, if not two other orthopedic surgeons. And understand, Pete, this is what really used to bug the heck out of me. Yeah. There are two things. They would look at me and they go, well, I appreciate you seeing me. Well, you had an appointment to see me. What? Well, when I went to see my doc, all I would see was I would see a nurse practitioner or a physician's assistant. Yeah, I know initially, but then the doc would come in and I would never see the doc. Okay, that's number one. Number two, what used to really bother me is when people would look at me and I'd do the history. I mean, because that's going to give me a lot of information, a huge chunk of where we're going. And they'd look at me and they go, no one's ever asked me questions like this before.
Yeah.
What?
I mean, none of the doctors never even did an orthopedic exam, right?
And then the third thing they would do, I do this physical exam, and they'd look at me and they go, oh, well, no one ever did an exam to check my motion or my strength or what motions when you
my
move
doctor
me around.
Never touched me before. Now, my doctor's never even touched me before, right?
No, but right. I mean,
right.
So then you get into this, like you brought up before. You got the bean counters telling docs you're only going to spend 5 minutes with a patient, and if not, what we're going to do is we're going to text. No, this is what happens. Text your nurse working with you, because we got a handle on everything you're doing, and find out why you're spending so much time in that room, because you're over 5 minutes. Okay, so I'm not trying to make excuses for docs for not doing a history, not doing an appropriate physical examination, because they should be, okay? I'm not making excuses for docs that have their PA. Look, PAs do a great job, nurse practitioners do the same job, but doggone it, my philosophy, and some people really had problems with me on this, I'd say people are coming to see me. They're not coming to see the nurse practitioner or the PA in our office.
Right.
Okay? They're coming to see me.
Right.
So they're going to see me. Not enough docs do that because the bean counters nowadays are telling them you're going to have the PA see X number of patients and you're going to oversee what the PA does. And whether you see the patient or not, whatever.
Yeah. So, Leslie, you ready to go down the rabbit hole with me?
Yeah.
Okay. All right. So inside of this paradigm, right, we've got the history. Let's say this guy's a carpenter. And, he's using his body all the time because that's what he does. Right? So ostensibly, then, that would be one of the drivers of the inflammation in the arthritic joint, right? Mm-hmm. Mm-hmm. But not all carpenters get arthritis.
No, that's true. That's absolutely true.
Right. So what was it actually that was causing the inflammation?
Well, so in retrospect, and I look
Now, I
at
don't want
my
to talk
case,
about retrospect because I know now you know.
right?
But back in the day,
20 years ago.
when you're assessing people, and now orthopedic doctors in a practice, they're assessing people. Does anybody ever talk about why the joint went arthritic in the first place?
No, other than repetitive activity or a traumatic event in the past or whatever. No, the answer to that is no.
Okay, and that therein lies the dividing line between the allopathic approach and the holistic approach, right? Because in holistic medicine, the basic philosophical understanding is that the human body knows how to fix itself, the human body wants to fix itself, the human body's trying to fix itself all of the time. So when something goes wrong somewhere in the body, whether it's a joint or an organ or whatever, we don't just think, whoa, that's life. Oh, you're getting older. And I heard somebody on the radio the other day or on somebody's podcast, he said, well, the reason that we get sicker now is because we shouldn't really be living over than 35 years of age, because that's really the human life expectancy. And because of all of the advances in medicine, now we're living into our 80s. The human body is not evolutionarily prepared to do that, and so that's why everything is breaking down the older that we get. And again, that's a ridiculous point of view. Because in point of fact, just from genetics, every time a cell divides, it loses a little bit of information. It's like making a copy of a copy. And you can only do that so many times before there's no more information left. And that time, in a perfect world, our bodies have the potential to live to be 120 years of age. 120 years of age genetically, but we're lucky in this country if we make it to 80. So that argument, we shouldn't be living as long as we're living, and that's why everybody gets sick now, because we're just not evolutionarily prepared to, have a kidney that's over 35 years of age. It's nonsense. But I digress, right? So in holistic medicine, we think, well, okay, all right, so here's what I know. I know that the human body knows how to fix itself. I know that the human body wants to fix itself. I know that the human body's trying to fix itself. So what is it that's causing the inflammatory biochemicals to be present in the human body? Why is that happening? Okay. Most of the time, the vast majority of the time, the inflammation of the joint occurs simply because the body has run out of the stuff that it needs to keep the joint healthy. That's it. Plus, there's two other things. Actually, that's not it. Plus, people are unwittingly eating food that's causing inflammation. It's pouring. There are inflammatory biochemicals called free radicals that are in the food. And you're swallowing them, and now those inflammatory biochemicals are in your blood. What do inflammatory biochemicals do? They cause inflammation. Well, okay. Well, the body knows that happens. The body has mechanisms, a fire department that it uses to put out the fires of inflammation. But what does the fire department need in order to work? Nutrients. Well, what happens if your neighbor's house is on fire? The fire trucks show up, they plug the hose into the hydrant, but there's no water in the hydrant. Well, the house is going to burn down. There's no water in the hydrant. So if there's inflammation happening in the body simply because you're walking down the street and you're breathing in automobile exhaust, or because you're eating inflammatory foods and you didn't know it, your body tries to fight that, but it doesn't have the raw materials it needs to fight it, the inflammation's going to win. The body's going to lose. So, an inflammation is like one match burns down a whole forest. All it takes is a little bit of inflammation unchecked, and then a little more, 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 and then a little more. Now all of a sudden the joint's in trouble. Not because you were a carpenter, not because you were, a white male with a history of arthritis in your family. But simply because your body ran out of the stuff it needed to keep the joint healthy, and you were unwittingly eating food that promoted inflammation all the time. So, that begs the question, what are we going to do to fix it? Well, maybe we can fix it, maybe we can't. Because I don't have a crystal ball. There is a point beyond which the body can't fix that anymore. Mm-hmm. Right? I mean, I don't know anything that's going to grow back a finger if you cut it off in a buzzsaw. Mm-hmm. That's too far. You went too far. It's too much. You can't fix that. Mm-hmm. So sometimes the joint, in this case, you've waited too long. There's too much damage. There's too much inflammation. It's gone beyond the body's ability to fix it. Sometimes that happens. Mm-hmm. But as you well know, all that the surgeons are taught is surgery. Mm-hmm. So whenever you have if all you have is a hammer, everything looks like a nail, right? Mm-hmm. So we got to, that needs surgery. Maybe not now, but 5 years from now, it's just gonna get worse. You might as well just belly on up to the bar and do it now while you're healthy and you can handle the stress of the surgery. Mm-hmm. I was talking to a patient just last week. He had, I think, was it one? He had both of his hips removed. And after the surgery, he was talking to the surgeon. The surgeon said, geez, I really hated to do that surgery because once we got in there, your hips looked fine. So sometimes you do need the surgery, but from my profession's point of view, we use surgery if it's a non-medical emergency, like you're not bleeding to death, right? You don't have a bullet in your head, right?
Right.
We use surgery for non-life-threatening conditions as the last resort.
Right. Because
maybe your body can fix it. Mm-hmm. Mm-hmm. This is why my book was called Attempt a Cure, because nothing's guaranteed, but you might as well give it the old college try. And this is kind of like never fail fudge from our point of view, because even if the joint in this case is too far gone, can't fix it, well, what would you rather do? Would you rather enter into a surgical arena in an under-nutrified and weak body or a nutrified and strong body?
Yep, that's right. And you see it time and time again. I can tell you as a surgeon, the people that are the most nutrified do the best.
100%. And
it's not even close.
I've never crunched the numbers, but I don't know. It's 100% of my patients who actually do need surgery. They recover in half the time that the surgeon's going. I mean, it's 2 months and you're 100% better. It usually takes 6. So it's like that. But the point here is that the training, the allopathic training, is based upon the notion that the human body is a bag of biochemicals waiting to break. It's only a matter of time until something breaks. If the body could fix it, it never would have gotten broken in the first place. And so shut up and take your drug and just sign up for the surgery, because it's only a matter of time until you need that. So, I mean, why not do that? Right? Whereas the naturopathic point of view is, the body's trying to fix itself. Maybe the body can fix itself. The body wants to be healthy. And so let's attempt to fix it. And what do we do to attempt to fix it? We give the body the stuff it needs to have a healthy joint. We stop eating foods that's causing inflammation. We give botanical medicines which promote joint health. We get the hell out of the way. We keep our fingers crossed and we see how far back the body bounces. And that's a smarter and a better way to do it.
It is, by far. By far.
But a patient cured is a customer loss.
And there's a reason why we talk about the foundation pack, because it's the foundation of how to handle situations. So the body does have the optimal fuel to heal itself, right? Whether it's arthritis or whatever the condition might be, you need a foundational nutritional support program. So take us through, Pete, the components of the foundation pack.
Well, I will in just a second, but there is one thing that I'm interested in from your point of view. Okay? Right? Because sometimes you need the surgery.
Yeah.
Right? And, I mean, there's good bricklayers and there's bad bricklayers. There's good plumbers and there's bad plumbers. There's good chefs and there's bad chefs. if somebody has done the holistic stuff
Right.
and they need the surgery,
Yeah.
or it's a traumatic thing,
Mm-hmm.
they need the surgery.
Mm-hmm.
How can you tell if your surgeon's good or not?
Word of mouth.
Word of mouth.
It's the single most effective way. So if you're going through a non-operative program and things just aren't getting turned around, and you're in physical therapy, you're going to be there with other people that are going through a non-operative approach, but you're also going to see people that are there that have had surgery.
Yeah.
Watch them, right? Watch them. And also, if you like and know and trust your physical therapist, ask your physical therapist. If you have friends or family that have had a whatever problem it is, that someone, let's say, has to have thyroid surgery, or somebody who has to have surgery on their stomach, or somebody that has to have surgery on their bowels, or somebody that has to have surgery orthopedically, talk to family and friends, neighbors. Say, hey, who did you have and what did you think? How did that go? Well, I had so-and-so, but, a friend of mine had this other person, and holy cow, did they improve quicker, right?
Yeah.
So I constantly had referrals from patients. People would come see me that watched my patients improving on the non-operative program we had them on, or if they had surgery, ultimately ended up having to have surgery, and how they did in physical therapy.
Well, it all comes down to common sense, right?
Yeah,
just ask around.
And yes, you can get the input of your treating physician, your family doc, your internist, but what's I think even more important than that is word of mouth.
Yeah.
Word of mouth.
Well, because it goes to the old joke, right? What do you call the person that graduates last in medical school?
Mm-hmm. Doc.
Doctor.
So here's an example of that. I cannot mention the name, but there was a very, very famous professional athlete that had a problem, orthopedic problem, and they came to see me. And they live on the other side of the country. And I said to this very, very well-known professional athlete, there's 3,000 other orthopedic surgeons between you and me, where you live and where we're at now. Why did you come here? And he said, because I talk to a lot of other people that are in professional sports, and they tell me that you're somebody who tries to take care of people without having to do surgery. And you get them better with the different programs you institute. And that's why I'm here. And if I have to have surgery, I want you to do it. Because I also know some professional athletes who had surgery from you after an extended period of time of being treated non-operatively and didn't quite get to where they needed to be. And they did very well.
Gotta love word of mouth.
Right. And in this day and age of the internet, word of mouth is not just the person next door.
Yeah, Angie's list.
Yeah, I mean it's incredible.
But you know what I'm searching for the right word. I don't know if I don't know if it's a tragedy, but it's just a darn tootin' shame. The shame here is that, especially when it comes to surgery, there is so much that would benefit the patient if our two professions came together.
Oh, absolutely. But Pete,
I mean, I could cut in half
Yep.
the amount of pain meds that person needs to take.
Yep.
I could cut in half the amount of time it takes for them to recover.
That's right.
But that's not good business, right?
No.
And that's why it's never going to happen.
Well, and I can tell you something else. When it comes to arthritis, and in particular arthritis of a joint, I found that you could drastically reduce the number of joint replacements you do. This was starting 15, 20 years ago, with a course of acupuncture.
Yeah, there you go.
Combined with other non-operative treatment.
Yep. There's one homeopathic medicine that costs like $10. It's made from plant, which if you give it a couple doses of it before and a couple doses after surgery, dramatically reduces pain. And it's not, it doesn't mask the pain.
No. Decrease the requirements. Just to decrease the requirements.
People suffer needlessly because of the monopolized medical market. Bobby Kennedy, he's on social media all the time. Oh, when I'm elected president, we're going to tackle the chronic disease problem because we spend more on disease treatment in the United States, just as much as we do on national defense. And he's right about that.
Yeah, he is.
But you can't fix the problem with allopathic medicine. You can't do it.
No.
It's the wrong dog for that hunt. My colleagues and I have been fixing chronic disease for hundreds of years. Fixing it, eliminating, curing it, because of our philosophical understanding, which is consistent with natural law. And that's what needs to happen in order to fix the chronic disease epidemic. We don't need more research. We don't need a blank slate so that the drug companies can put all kinds of experimental drugs with, no more checks and balances. Do whatever the hell you want, boys. It's the Wild West. That's not it. This is a complete paradigm shift that the holistic method is the method to lean on here if we're attempting to fix a chronic disease situation. But I don't think, it's an idea that's probably 150 years ahead of its time.
So as we conclude here today, Pete, go through the foundation pack and the components, because the foundation pack is the nutritional support program available on OperationFreedomHealth.com that, if you will, sets your body in motion. It fuels the fire of healing. Educate our listeners on the components of the foundation pack.
So here's what's in it.
Because some people say, I'm going to take a Centrum vitamin and that's it. That's all I need. That's what I need. That's the ticket. No, educate our listeners, because that's not the ticket.
Yeah, so I had a patient who had a porta potty, his brother-in-law had a porta potty business in Florida. And we were talking about it, and he said, you know what they call the porta potties in Florida? I said, what? Vitamin machines. I said, what are you talking about? He said, well, when they empty them, they're filled with Centrum Silvers. He said, how do you know it's a Centrum Silver? Because you can still read it on the tablet. Because, the elderly people who've got a digestive system super weak, because they're on a salt-restricted diet and they don't have enough calcium in their body, which you need for strong stomach acid, they swallow the Centrum Silver and they poop it out, completely unabsorbed. No, that's not a good idea.
No.
So I'm a cheerleader for these supplements. Beyond Tangy Tangerine 2.5, which is a multivitamin, multi-mineral, prebiotic, probiotic, postbiotic. It's got some other stuff in it. Beyond OsteoFX, the most absorbable calcium I've ever seen in my life. This is a fantastic product. Plant-derived minerals, organic plant-derived trace minerals, which give your body 66% of its nutrient needs. And the fish oil capsules. These combination of these 4 supplements is called the Healthy Foundation Pack, and it gives to your body 100% of its essential nutrient needs: 60 minerals, 16 vitamins, 12 amino acids, 2 fatty acids. These are things that your body needs but your body can't make. And these things are no longer in your food in sufficient amounts to make you healthy. This is one of the reasons why chronic disease is escalating.
That's right.
Because the stuff that your body needs just to maintain its health is no longer present in the food. Some of it is, or you'd be dead. But the reason that you get sicker the older that you get is because your body it's a slow burn. You run out of this stuff and then things break. So this is a game changer. We gave these products to 10,000 people over 9 years. 83% of them, 83%, like Dave,
from all comers, all conditions,
had remarkable health recoveries just from giving your body the stuff it needs to fix itself. And that's not a bad idea, right?
Right.
OperationFreedomHealth.com. Check it out. Slam these doors, kick these tires. If you don't try this stuff, there's something wrong with you. Seriously. I mean, I'm going to say it out loud. It's not politically correct. Why wouldn't you try this?
Yeah, there is no reason not to.
There is no reason not to do it.
Yeah, other than being caught in a false matrix. and then okay, I'm not. This won't. Nutritional support doesn't work. It does work. And in this day and age of the economy being horrendous, no matter what you hear on the boob tube, as my parents used to call it, what we're doing at OperationFreedomHealth.com, if you use the coupon code FREEDOM at checkout, you get a 10% discount on your entire order. That's because the economy is so lousy, and we're trying to make it so that there's one less reason for folks not to try this. OperationFreedomHealth.com and Dr. Glidden's site, LeaveBigPharmaBehind.com, with this chock full of a tremendous amount of information. You can subscribe to Dr. Glidden's service, where he holds seminars several times a week. They're fantastic, educationally based, and a tremendous amount of information. Pete, I'd like to thank you for everything you have done, are doing, and will do. I thank you folks for joining us today in this conversation that you'll hear nowhere else. Until next time, Dave Janda signing off. Dream big and dare to fail. Thanks for your time today.